Ankle sprains, another common problem in the office. And let's entertain two more questions. What are ankle sprain treatment options and what are the surgical options? Well, there's many different types of ankle sprains themselves. There's eversion, there's inversion, but let's talk about the more common one, which is the inversion, slipping or stepping off a curb, stepping in a pothole, that type of sprain. And it has three grades. There's grade 1, which is kind of a stretching of the ligaments, and then there's a grade 2, which is a partial tear, and then there's a grade 3, which is a complete tear, and they're all on the outside. So here is the fibula right here, and this is the outside of the foot. So the one in front is the anterior talofibular, it goes between the fibula and the talus. That's the most commonly sprained one because the foot comes down like that, and it really pulls on that one. We can test that with the anterior drawer maneuver, and that is stabilizing the patient and pushing in the back of the heel. And if it slips forward, of course, you know this is probably damaged, if not partially torn. Calcaneofibular is a strap here that also gets injured with an inversion sprain. Not so common is the posterior talofibular, and that one there is more of a jarring maneuver. Usually the foot kind of goes backwards, you hit it here, and the leg goes forward, and then this one, the back tears. The treatments are pretty simple. If it's a grade 1 or 2, you can actually get by. Grade 1, of course, everything from ice and maybe something, an ACE wrap, getting by the first few days with some ibuprofen or Tylenol. It's basically limited by your pain. That's 1 to 3 weeks they take to usually heal. The grade 2, which is a partial tear, those take about 3 to 4 weeks to heal, and then 6 weeks when you can really pull on the ankle. That's called tensile strength. Complete rupture, again, you'd want to put your foot not so much in a dangling position, but up at 90 degrees, everted out a little bit in a splint, or you can wear one of the walking boots. And for a non-athlete, the standard of care is if it's completely torn and not retracted, but the ends are touching, well, it will scar in over time. Great place to talk about the surgeries. That also can be just the anterior talofibular, or again, commonly the calcaneal fib. There are a couple of procedures. One is simply to tie it back together, fold it upon itself. If it's pulled away from the bone here, you can actually use a bone anchor to fortify the attachment. If it's completely blown out, all 3 ligaments, sometimes peroneal damage, which is a tendon that comes on the outside here, we can do something called modified rostrum, with also some splitting of the tendon and reinforcing it with your own graft. So treatment options surgically do vary as well, but again, the healing time's about the same, which is 6 to 8 weeks. Again, hopefully that was helpful. But if you do have your own questions, you can log on to the Ask Dr. Moore YouTube channel, and in the comments section, place something that you'd like me to answer, and I'll do my best to get to it. Thanks for tuning in. Stay healthy and one step ahead.